The CDC's Vaccine Advisory Committee will now hold an emergency meeting to talk about the rare cases of heart inflammation happening in some young people after getting the COVID-19 vaccine next week. The agency postponing the meeting because of Juneteenth. The latest CDC data shows more than 300 reported cases of myocarditis in young people. Meanwhile, the Georgia Department of Public Health says they are investigating 10 suspected cases in our state. The Verified team is tracking your questions when it comes to symptoms of the condition. Liza Lucas breaks it down.
It's an issue on the CDC's radar, and Tanya has questions. When it comes to reports of myocarditis in young people following the vaccine, she wants to know what to look for and to confirm if the heart condition shows up within a certain time frame after getting the shot. Let's verify. Our sources, the Centers for Disease Control and Prevention, a June 10th FDA advisory panel meeting, and Dr. Preeti Jaggi, pediatric infectious disease physician at Children's Healthcare of Atlanta.
We do know that this still is rare. Given the number of vaccine doses that have been given.
Experts want to be clear about that point. Still, the CDC is investigating after early data indicates a higher than usual number of cases of myocarditis in young adults after getting the mRNA vaccine. The majority of cases reported in young men following their second dose of either the Pfizer or Moderna vaccine.
There are some patients that have had it after the first dose, but definitely more common after the second dose. So if you hear about some of those symptoms pretty soon after that second dose of the vaccine, that would be something to consider and you'd want to seek medical care.
Speaking of symptoms, back to Tanya's question. According to data from the FDA meeting, we can verify symptoms of reported myocarditis cases typically showed up within 2 to 3 days after getting the vaccine. Chest pain was the most common symptom for those under 30. While severity varies, the CDC says most people respond well to treatment. It's also important to note the heart condition is sometimes caused by a viral infection as well.
It's definitely something that we saw prior to the pandemic, especially in the summer months, and a variety of different illnesses can cause that.
So we can confirm symptoms of chest pain connected to the rare cases most often appear within days of the second dose. And for now, health officials continue to recommend COVID-19 vaccinations for everyone ages 12 and older.
A newly released study on the issue shows the condition may be temporary and easy to treat. They say the 7 men involved in the study who had myocarditis didn't have any more symptoms after 2 to 4 days. Again, we've learned the CDC panel's meeting has been postponed until next week.